All right, morning, guys. My name is Keith. I'm the director of senior system director for infection prevention for Hartford Healthcare. Morning, and Dr. Kumar, as Tina said, Dr. Kumar couldn't be with us, so I have the pleasure of delivering our system updates to you guys, and then introducing one of my highly esteemed colleague to speak to some initiatives that we need to keep working on in order to ensure that some of the news that I will talk about today, or some of the data that I will talk about today, and the good part of it, there's a reason why we're having these discussions, and we need to ensure that we maintain that focus. Right, so I'll start with just data from our general system. So currently throughout the system, we have a total of 491 cases of COVID-19 positive patients, 136 PUIs, so there's patients that are under investigations currently. And how that breakdown is, for Charlotte-Hungerford, there's 18 patients that are positive, 5 PUIs. For Hartford Hospital, there's 158 patients that are positive, and 58 PUIs. For Midstate Medical Center, there is 26 positive and 9 PUIs. For St. Vincent's, there's 89 positives and 15 PUIs. And for Hospital of Central Connecticut, there's 45 positives and 19 PUIs. And for Wyndham Hospital, there's 3 positives and 3 PUIs. For the Behavioral Health Network, currently there's 1 positive patient and 3 PUIs. For Community Health Network, which is a huge part of our transition of care, there's 141 patients that are positive and 19 PUIs. That 141 has a lot to do with the amount of people that we've transitioned through the acute care system and is now way to full recovery and is being cared for by our Community Health Network folks. So that's within itself is some good news. There's this morning when we looked at the data, there's a few things that I wanted to move to. It's probably a slightly higher level with some more specifics. So when you look at the data currently, so from our acute care settings, we have a total of 349 patients that are positive. If we look at that 349 and we compare it to what happened on 4/15, so on 4/15 we're at 386 patients that were positive with 82 PUIs. So we've reduced, over that time period, we've been reducing, we're seeing a reduction in our positive patients, and that's a very, very good thing. So when people ask, and generally people will ask, Keith, where do you see this going? When do you see this breaking? So there's some light to be seen at the end of the tunnel at this point. There's some reduction, and as I said before, 4/15, so April 15, we're at 386. And now we are at 349 in our acute care setting, and that's very positive. Another positive piece of it is when we look at our community health network spaces, again, that represent the transition of care in Hartford Healthcare System, we see an increase in the numbers now, which means there's a lot of patients that are transitioning to that level of care, which is very, very positive. Some other news for Hartford Healthcare, as we identify that there's a need to increase testing capability, testing availability. One of the things we've invested in doing for the community is doing a mobile testing site, and in partnership with the City of Hartford and Open Heart, we've opened a mobile testing site, and that will give extensive capability throughout the community of Hartford. So Hartford Healthcare has always had, or since the inception.
Something's wrong, we've lost you.
Since the beginning of this, Hartford Healthcare has established the most available process to get tested for the community. But we still realize and recognize there's people, an institution that doesn't have the capability to get to the sites that we've established. And the need for testing in order to understand where the community is and how that impacts the resources of the health system. We've identified and launched the mobile testing site, which I think that's a very good initiative. Hartford Healthcare is also expanding its COVID-19 capability with 3 new community testing locations to include Newington. And as I said before, there's a new mobile testing unit, so that's very positive. So the mobile vehicle and 3 testing sites in Newington, Mystic, and Westport. So the new testing sites are going to be Newington, in Mystic, and in Westport. So that will help increase our capacity. And I think at this point, our current capacity, or the predicted current capacities, the aim is to test about 2,500 patients per day. Again, 2,500 individuals per day, and that's a capability that we will aim for, and we'll be able to sustain based on our resources we're seeing right now. Key initiative to reach vulnerable population, as I said before, and the overall epidemiological impact is to have an understanding of the community impact. So again, we're going to open up testing. I shouldn't just say open up testing, but we're going to increase our capability to test, and we're going to increase the availability of the testing. And through that, we'll have an increased set of data that we could look at epidemiologically to see the impact on the community, and we know how important that is. So as I said, I started this by saying that, we're seeing decreasing numbers. There's a reason why we're seeing decreasing numbers, and it's because I strongly believe this has a lot to do with the community's responsibility, the responsibility that was put forward with like social distancing, so to speak, and that's gotten us to a point where now we can talk about, ideas such as reopening. But what we've seen over the last few days as well, and this is something to be very cautious of, is the increase in presence in the emergency department with positive COVID-19 patients. I'm going to introduce Dr. Ken Robinson, who is a key figure in the medicine emergency department, and he'll talk a little bit more on this. Dr. Robinson.
Good morning. And I would like to start by echoing what Keith said, that the reason we are in a place that we can start thinking about opening certain aspects of society up is that social distancing and the community's response has been going so well. People have really been doing a good job of social distancing, wearing masks. I know it's frustrating to stay at home, but that's been going really well, and that has allowed us to start to be at a point right now where we can start thinking about opening things up. But a word of caution, while the hospitalization number for the entire state is down, and at Hartford Hospital, our hospitalization rate is down slightly from our peak of a week or a week and a half ago, we're still at a really high plateau, and in fact, today we have more patients admitted to Hartford Hospital than we did yesterday who are COVID or COVID suspected. So we really need to emphasize that we need to keep attention to social distancing and everything that entails, wearing masks, being as mindful about this as we can. Another thing that I would like to emphasize is the fact that it's safe to come to the emergency department. Certainly if you have symptoms of COVID-19 and you're worried, we're always there for you. If you don't think you have COVID, but you have another concern or other set of symptoms, then you should feel free to and feel comfortable and safe coming to the department. Our emergency department, we have it divided up into a COVID suspected area and a non-COVID area. And we do everything absolutely possible to make sure that we keep those two groups of patients separate so that we do not unnecessarily infect anyone that we don't think has been exposed to COVID or has COVID. Now, what you'll notice is if you come to the emergency department is that you'll be asked questions a number of times, the same questions by a number of people, perhaps the triage nurse and then another nurse and then probably a couple of providers, all trying to determine whether you've had symptoms or not. And it might be a little bit frustrating, but I ask you to bear with us because this is really to keep everyone as safe as possible and to make sure that we don't miss anything. So again, the emergency department is opened and it's perfectly safe to come to the department to be seen, even if you don't have COVID-related symptoms. So please, we encourage you to feel comfortable doing so. With that, I would like to introduce Carolyn Ayala, who's the coordinator for microbiology at St. Vincent's Medical Center. She's joining us via Zoom.
Hi, good morning. I'm glad to be joining everybody today to give a microbiology perspective on things. This is a point where a lot of the testing is coming through. Testing is very good for infectious diseases. It helps to know what patients we need to isolate to keep everybody safe. It also provides doctors the information they need to treat those patients. The second part of the testing is not only a positive result, but it would be a negative result. And that is just as important with COVID and in any infectious disease. These patients will need to can be placed in a different section of the hospital and no longer need to be having PPE, personal protective equipment, such as gloves, gowns, and masks, which there is a severe shortage of. The negative test will also allow the patients to be discharged quicker. Quicker discharge means that a patient who is very sick has an opportunity now to get a bed in the hospital. The microbiology department this morning, it has resulted out close to 70 results. I have to say we are seeing a change in those results. In the beginning of testing, most of them were positive. At this moment, most of them are starting to turn negative. And we hope that this is a good sign that people are following the precautions, wearing their masks, social distancing, and abiding by the recommendations that have been given out to keep everybody safe. So with that, I'd like to say, everybody, take precautions, wear your masks, wash your hands, keep your social distancing, and stay well.
All right. Thank you so much. So I know we did during, at some point we did lose some audio. Is there anything that any questions about anything that we went over, and is there anything that you guys probably need us to repeat? Any questions?
Yeah, I think after we had a point there, you were talking about, you know, the light at the end of the tunnel, and that there was, you know, that there was a need to increase testing. You also talked about the mobile lab.
Good. Yeah.
Can you expand a little bit beyond that? Because that's where I think you lost the audio for about a minute and a half to 2 minutes, if you can remember.
Good. Again, sorry about that. You know, this is still, there's much we're learning, a lot of technical difficulties at most times through this. But as I said, the need for testing or increased testing that's not new. So we know this is necessary. And what Hartford Healthcare has done in the beginning of this is establish a test center. In multiple areas, they've established test centers for the communities. And what we will be doing, or what we have done, is increasing not only our capability, again, but we've also increased our availability in that we've created mobile units and mobile sites in order to facilitate areas in the communities that probably can't reach to the areas that's already set up by Hartford Healthcare. The other piece of it is our committed capacity right now is at 2,500 tests per day, which is quite significant compared to where we were a few weeks ago. So again, we've increased our access. We're increasing our access points, and we're increasing our possibility or our potential to reach people that can't get to our stationary sites by creating these mobile units, and we've also increased our capacity, our committed capacity testing.
If I can just, this is Box 61. If I can just add a question a little bit. What is the situation with the mobile testing labs, and how are you integrating that into your testing regimen? I mean, who can show up at the testing lab, and how does that work?
Yeah, so the testing lab, how it's been set up from before, still exists. So you still call the Hartford Healthcare hotline, and you will have the ability to speak to someone that it's trained and has the capability to decide if a test is necessary. And at that point in time, if a recommendation is there that you need to speak with your PCP, and the PCP will put the actual order in, and that will initiate the process. An order will go in, your PCP, your primary care will put an order in, and at that point in time, the test will generate, you will go have contact with the site, and that will be done. The logistic in that, will the site have the capability of actually putting test orders in? That's also going to be done as well.
This is Emily Brindley from The Current. I had a question about when elective surgeries may resume. Is there any plans for when those might start back up again?
There's plans. I don't want to commit to a date at this point, but there's ongoing plans. There's a lot of decisions to be made around that, but there's absolutely plans. It's very soon we're going to start looking into operationalizing, resuming elective surgeries. I think there's a big need in the community, and we've established initiatives that we know will keep everyone safe and move our processes forward.
And I know you said you don't want to give a specific date, but could you put a time frame on that? Are you talking days, weeks from now?
I would say I'm not too sure. I don't know if I can be as specific about it at this point. I mean, a lot of this has to do with not just our decision. A lot of this has to do with ensuring that whatever we're doing is with the safest methods possible. It's in coordination with all the regulatory bodies. It's the communication with the state and government and federal agencies. So it's not just via Hartford Healthcare's decision process. So there's way too much moving parts right now for me to specifically say when. But it's as soon as it is viably possible, Hartford Healthcare will be up and running with elective surgeries. Absolutely.
Can you speak to the issue of call volume that you're receiving, or what are you? I would assume that you're charting that on a day-to-day basis in terms of requests for testing. Where do you stand right now as opposed to where you were, say, 3 or 4 weeks ago?
To be honest with you, I don't have those numbers. What I can do, the next time we meet, I can ensure that those numbers are available. But that's a very good question for a number of reasons, because you would think that has some bearing on how, one, the availability of testing, obviously, the access to testing, the mentality, the general mentality, as in people needing to go test. So data we do have focus on, we pay a lot of attention to, but I don't have those data to let you know right now. But I can ensure that those are available next time we speak.
All right, thank you.
Anything else?
Hi, this is Shantae with Channel 3. I kind of wanted to switch gears. Since yesterday we've been talking about this possible breakthrough drug, remdesivir. I wanted to know, what's the healthcare network's thoughts on that?
So remdesivir is a very, very promising drug in research. There's a research study that was done. It was one of the only fully controlled study that was done that showed very positive response from patients recovering response to the drug remdesivir. And we're constantly looking into this. This is a drug that is being used at Hartford Healthcare. as you would imagine, our medical teams pay very close attention to this, and in many cases are involved with as much study that there is out there to ensure that we're delivering the best care possible. So yes, this is a drug we're very much aware of and we're using, and the capability and capacity of usage is something that we've not just now since that study, but before now, we've been looking at. Anything else?
We do have a question from Facebook from Betty. She asks, we have many, many families in quarantine who have tested positive but were sent home from the ER. Do they have someone overseeing all these people in quarantine?
Betty, that's a very, very good question. So I can answer a part of that question, and then I could ask Dr. Robinson to answer the other part of it. Part of the question that I will answer is, anyone that's sent home from the ED is noted not to be critical enough to be in the hospital setting. And that's the only reason. There's no one that will be sent home from the ED at all. At no point in this process, even at the highest point that we've had, there's no one that's been sent home from the ED that we deem that would be a risk to the community, a health risk, would be too critical that they might go in a different direction. So the advice to send someone home is generally is someone that's not critical but is tested positive, someone that's not critical but might have some mild symptoms. But anyone with severe symptoms would be in the hospital setting. I'll ask Dr. Ken Robinson to speak on the fact that there's education given to these patients and the process of the actual emergency department triaging and processing these patients. Dr. Robinson.
I second what,
American.
this is Ken Robinson. I'll just finish up answering that question, then we'll take your question if you don't mind. I will second what Keith said, that we are very careful with whom we send home from the emergency department, and we ensure that it's safe for them to be discharged home. If they are positive, or even if they're not and their test is pending, we will go over a long list of instructions with them verbally, and also give them written instructions as well. And then we ask the patients to follow up with their primary care doctor. We're always available if, God forbid, something happens and they feel more sick and they need to come back and be seen again. Did you have a question?
Yes, Dr. Robinson. Question, you mentioned that we are at a place where we could start thinking about opening certain parts of the economy again, and thanks to social distancing and community response, we're doing as well as we are. Could you elaborate on that a little bit? I know it's a very complicated matter, and we don't really know where we're going in some respects, but what do you think about how we can go forward with opening certain parts of our economy back up?
Well, let me start by saying I'm an emergency physician, not an epidemiologist. But my opinion is that we're not quite ready to open up parts of the economy yet. My worry is that we're still at a really high level of cases. While it's a plateau, it's still a really high level. And if we were to relax social distancing at this point, I am worried that more people would be infected and we'd see another peak.
Okay, I'm sorry. I thought you said earlier that we can start thinking about opening certain aspects.
I said that others are. I thought you just asked my opinion.
Sorry. Okay, thank you.
Is there anything else? Any other questions? Okay, thank you, everyone. Talk to you tomorrow.